Aaron, it's so good to have you back.
It's so good to be back, especially
I know.
after running around the house to find all the right stuff that'll work.
Right. It's your first podcast, right?
Yeah, ever.
Obviously, your first Zoom call, first podcast.
There you go.
Uh, all right. I'm burning to ask you this simple question.
All right.
These young doctors that are opening up practices, I keep telling them that they need to make sure that they do 2 procedures in order they build their practice and even hopefully get to 1 million in collections in the first year. Am I right or am I wrong?
Well, what are the 2 procedures?
Extractions and root canals.
There you go. You're singing my song. I think so. Okay. I mean, the simple fact is whether you're starting your own practice, you purchase a practice, or you're working for someone else, you're basically building a practice. And either in someone else's practice, in your own practice, or as part of a practice. And the bottom line is you want to be able to see emergencies. And if you're the guy that gets them out of pain or girl that gets them out of pain, then you got a shot at saying, hey, let's have this never happen to you again. Let's have you come in and let's just look at everything and make sure that we just, if there's anything coming up that's going to do this to you again, that we can head that off at the pass and just make it so you're not waking up in the middle of the night with pain, and you're not having a tooth that hurts and hurts and hurts, and you're not all of a sudden having a swelling and trying to avoid it and all those things. If you're the one that gets them out of pain, that gives you a shot at it. When I was a young doc, I came fresh out of dental school. I did what you guys call a de novo startup, just like from scratch, and those folks would come in and I couldn't do molar root canals and I couldn't do extractions if there wasn't a tooth hanging above the gum line or they had plenty of periodontal disease. And so I would send them to the endodontist or I'd send them to the oral surgeon. And the problem is they would get them out of pain and then they were done. And no matter how much I told them it was really important they come back, they never came back, or almost never, And so if you can get them out of pain, you become the person that saved them that day, and you might have a shot at keeping them in practice.
Why is it so controversial?
Well, a couple, 3 reasons. Number one, when you're going to dental school, they have to take you from civilian to not dangerous doctor in 4 years. And only 2 of those years are you in clinic. And more doctors are being trained with less clinic time and less requirements. And many times the instructors are less experienced. Not always, but many times they're less experienced. So when I was going to dental school, we had a bunch of these guys who'd been in the Army or the Navy or the Air Force for forever. And they were retired now. And they were like in their late 60s, early late 60s. And they just kind of wanted something to do. And so teaching was kind of a good deal for them. And they had literally spent a career honing their craft. And those are the guys that we were instructed by all the time. Sometimes it backfired because they weren't up on some of the later techniques, but they kind of knew what they knew what they were doing, and they could guide you reliably. And most of the times could show you ways of doing things that were faster or more efficient, or would cause less of a problem for the patient post-operatively, et cetera, et cetera, et cetera. These days, we have some of those. And then we have doctors that haven't been in practice as long. We also have less doctors. So I believe that the student faculty ratio has gone up, if I'm not incorrect. And don't quote me on that one. That'd be an interesting thing to look at. But it seems like, I teach a couple of courses, as you know. So the 1 hour molar canal bone and crown. And I know that a lot of times I'm on the phone with docs and they're saying, hey, I don't know if this is an appropriate course for me because I've just come out of school and I've only done 3 root canals in my life. Is this going to be too advanced? Of course, I'm like, no, this is actually what I designed the course for. At the same time, I'll sometimes have docs that are out. They're like, I've been out 10, 12 years. I need to get back into doing this. Or I'm pretty good, but I just feel like I'm not as efficient as I could be. And the answer there is like, yes, I am by nature very efficient. I just don't like wasting time. And so I've worked my entire career to like get things smoother and easier and more predictable, which also makes it a lot easier to talk to assistants and get them kind of set up for you. But that's a lot of it. It's just a matter of there's not the time because you have to do everything else too. they still have to teach them how to do exams and how to do perio and, crown and bridge and fillings and, extractions, and so sometimes you're not going to get as much time in a particular specialty as you would like for them to have before they graduate.
But this one seems to me the most critical. Like if you really want to have a successful practice, and you and I are both big proponents of private practice ownership,
Yeah.
you kind of have to have these two things going. And the whole conversation started with a friend of mine, Irat and Regina, who are really good at it.
Mm-hmm.
And Irat told me after your course, which we're going to link it up for people.
Okay, cool.
Regina is a lot more comfortable doing root canals. And that is really what's building the success of the practice.
Yeah.
Like then everything else comes. Then you can fill in your hygiene schedule. But if you don't do these two things, Irat was like, what are you doing? Like you're really outsourcing these two things to other doctors?
Yeah, I mean, this is kind of the low-hanging fruit as far as I'm concerned. And a lot of times docs will go, well, I do anteriors and I'll do some premolars, but I don't want to do any molars. When it was interesting because when I was in dental school, they did not allow us to do molars. That was the official position of the staff. And I had this one teaching assistant, and I was like, is there any way I could get to do a molar? And she was like, well, find one that has really, really, really straight roots, and we'll go ask the head of the department. And so I kept bringing him x-rays and he kept going, nope, not straight enough. Nope, not straight enough. And finally I got the perfect tooth, or he got tired of seeing my face. It was one or the other. And he
Probably
let
both.
me, yeah, really. And he agreed to let me do the small root canal, but he also made the teaching assistant that suggested that I come talk to him be my TA on that one. And so we were working through it. And she just said to me, if worst comes to worst, treat it like 3 one-rooted teeth and do the pulpotomy, and then go through and do one root at a time and just bring the patient back multiple times. And, it's a plan. It's maybe not the best plan, but it would at least allow you to do the procedure and keep the patient in-house, although it's going to extend your treatment time quite a bit. And there's some things you do to make that go faster. But yeah, so getting to doing molars, super important. And then we're kind of at the same spot for extractions, because a lot of times, patients come in and they don't come in until it hurts. And not when it hurts the first time. It's like it's been hurting on and off. And now it's like, 3 months down the road and they're swollen and you got to get them numb. And that's proven to be a little hard. And now you got to take this tooth out. And a lot of times you put a forceps on that and it's just going to crumble, or you have a tooth that has a root canal in it already and they never got the crown. And so they've snapped off the crown. And now you've got to get the root out. So if you don't know how to handle those, then those go down the street to the oral surgeon. And guess what the oral surgeon says to him? Hey, let's take this tooth out and we'll get an implant and put that in there. And then I'll send you back to your doc to get the crown done. So you've lost the extraction, possibly the bone graft, and the implant as far as production goes. And maybe they come back to you. Who
Maybe
knows?
not.
Yeah, no. I've seen plenty of patients come in as new patients with implants placed, and they've been there for years, and say, who placed it, and then there's some kind of an issue, but you just don't know. And, once you can, two things. Once you can take a tooth out predictably without having to destroy the bone around the tooth, you get to a bone graft, if that's the right thing to do, okay, and prepare that site for an implant. And you can be darn sure that if you've prepared the site for the implant, it's going to be a way easier implant placement because you've gotten everything just the way you want it. B, in certain cases, you can actually take the tooth out, the root out, and place the implant same day, okay, which you obviously don't get the opportunity to do if you send it down the road. And I think those are the two kind of biggest things that you have going for you there. And by doing a great job at taking the tooth out, there's a higher likelihood that they're going to allow you to place the implant later on. So there's just so many good things. And then you're the guy that saved the day. Maybe they didn't get to sleep that night, and maybe they didn't get sleep the night before because that's what made them call you up, and now you're the guy that got them out of pain. And, that night they get a good night's sleep and you're a genius. The only times I've ever had a patient come in the door and say, "Doc, please stick me with the needle," was when they had been up for like 2-3 nights in just massive pain. And they're like, "Doc, just stick me, just do it." And you can almost do no wrong. You can, but you can almost do no wrong at that point because they've just been so miserable for so much time.
Wow. So why wouldn't someone learn how to do these procedures? Is it somebody that's teaching them that, hey, don't worry about these procedures, just focus on the bread and butter fillings? Or is it they're like afraid because they're complicated? What's stopping someone to do? Like, I know we talked about the dental schools. I don't want to beat the dead horse. Like, we know
Right.
the dental schools are busy. It's fine. But someone who's opening up a practice, the person has been an associate for like, I don't know, a year or two. They probably did something. So they're a little bit more comfortable with a handpiece. But
Mm-hmm.
what's the hesitation?
Yeah, I don't want to beat the dental schools too badly either, because there are a number of them that are doing a good job. But people that come to me, what I hear from them is, I did no root canals on real teeth, or I did it on a model, or I did one or two, and that was, I mean, when I was in dental school, it was pretty common. The thing that I think that keeps people from doing it is, you go to do the root canal and you work and work and work and work, and then you decide that you either can't do it, so you decide you're going to have to refer it, or you finally get it done, and then that night you get the phone call from the patient. It's just like, man, this thing is killing me. Like, I think it's worse than when it started. Like, are you sure you got the whole nerve out? And you have a few of those conversations where it drags on, and it just doesn't feel like you're enhancing the reputation of yourself or your practice. And then, after a while, it's like, it's just a lot easier for me to refer them down the road, and I'll do the crown when they come back. Again, if they come back, especially with root canals, because once they're out of pain and they have something in there. I mean, I've had patients come back years later, and they said, yeah, I went to the endodontist, and he did the root canal, and I'm ready to get my crown now. And they just had a temporary in there. And you go in there and half the temp's cracked out. It's decayed through the furcation. And it's like, I'm sorry, dude. Like, the only thing I can do at this point is take the tooth out. And we could talk about options for replacing it. And I had that happen
Yeah.
to me. A particular patient I'm remembering who, 2 teeth, he finally came in, was ready to do it. It's like, yeah, I'm sorry. We can't get anywhere. With extractions, most docs that that do really well with extractions, they're pretty quick. They're like 15, 20 minutes, they're all done. If you're not as good with extractions, it could be 15, 20 minutes and you're done, or we could be here for an hour and a half. And you start to, and then when you're there for an hour and a half, pretty soon you have assistants who are like standing in the hallway and going like, come on, man, like, you're wrecking the whole schedule. You've got hygienists that you're holding up. You've got the patient who's being stressed out. And after a while, it becomes a matter of, it's just not worth going through all that for what I'm going to get back. And it doesn't enhance my reputation. It doesn't enhance the reputation of the practice. It makes my staff, it pisses off my staff. And those are people you got to live and work with every day. And so you're trying to keep everything calm and everything moving in the right direction. And eventually, you tell a patient you can take out a tooth, and you see the assistant standing behind the patient going, or it's toward the end of the day and someone needs a tooth out. They're like, Doc, I need to get on time. I got to pick up my daughter. My husband expects dinner, et cetera, et cetera, et cetera, whatever their obligations are that evening. I'm going out with my girlfriends, whatever it is. And eventually you just stop, because you're just upsetting people, and you don't see where you're really moving it forward, and you're doing everything you know to do, but it's not getting the job done. A lot of times I think, and I stand behind dental schools 100% for this. It's like, we train to be safe and maybe not to be the most efficient that we can be, and after you've been out a little while, you're handling your instruments a little differently, it's time to start getting a little more efficient. I hear a lot of doctors, you get on these Facebook groups and stuff, and, you start talking about being more efficient and stuff. And they're like, you shouldn't be rushing through procedures. Just do them. Worry about the quality. The speed will come. Sometimes not, and if we know what works and is safe and helps to increase the efficiency of the practice and make a patient not have to sit for 3 hours in the chair getting a molar root canal, belt and crown, or 2 hours to get number 3 out, then why don't we just learn those things and move forward with our lives? When you go to a CE course, you're basically paying money for that doctor's time, for all the time it took him to learn, so that he could tell you that. So it's a lot easier to pay with money than it is to pay with time.
Right. But I think, I don't know, if I'm trying to put myself in the shoes of a doctor who's opening up a practice, like especially if I was an associate, that's a reputation of that practice, not mine.
Mm-hmm.
And so this is now the reputation of my practice. And I have to manage all that. And on top of it, I'm not 100% comfortable with these procedures. And what comes to my mind, like I would rather go and do some kind of charity work where I get to practice these things. Like not that they're designed for it, but I
Mm-hmm.
think most of the time when you do mission trips, they are based like it's just a bunch of extractions, if I understand correctly. So
it depends on which mission trip you go to. So there are a number of them that are very focused on kids. I go on a couple of I go on one trip regularly all the time, and it was originally predominantly extractions, then extractions and fillings, then it was extraction, fillings, and partials, and now we can actually do full dentures. So it just and we circulate people through that. I'm going on one on Friday, which is why you and I are talking today, and I expect it to be mostly extractions. It's just the way that that's going to lay out. So that's true. The extraction course that we do, actually, we were partnered with a free clinic in the States, and it's people that otherwise wouldn't get care, or it would take them a very long time to get care. And so they've signed up and they're ready to go as far as, coming in and the doctor helping them out. Excuse me, man, I have a cat that needs to go. Hey, buddy, go that way.
yeah, easy.
There you go. He was going to come in and give his 2 cents worth, but
Right.
he hasn't seen a lot of extraction. But yeah, so usually mission trips will give you a
Can
lot
fix
of
that.
yeah, will give you a lot of experience. It is one of the reasons I went on a mission trip my 3rd year in dental school and my 4th year was I didn't feel like I had enough reps in doing extractions, and I knew that going on a mission trip, that's what I would be doing mostly. And so I went and did it, and it's been a great experience over the years. And then it really got me up to speed much faster.
Yeah. And Aaron, I know our last podcast we did together, I think it was March of last year, if I'm not mistaken.
Sounds about right.
When you came to Austin.
Yeah, I was
And
in
so
Austin for a meeting.
it was a really in-depth conversation about where the dentistry is today. What are you concerned about? That we're basically not passing any knowledge from older docs to the younger generation, and they're just kind of learning on their own all the new stuff. So, and I'll link it up. People can go listen to it. But we're kind of hinting at the same thing that it's like life is a cycle, right? So you got to learn from people, like you said, you were learning from people that were in Air Force and Marines and that kind of stuff, and they've done all sorts of different things. And so I wonder why there's no more guidelines and direction for people to say, look, you're going to open a practice, which is amazing. These are the things you need to do. Like I feel like most people on Facebook talk about you're going to open the practice, you're going to buy ADEC chairs, you're going to do marketing, but nobody says sign up for a mission trip so that you actually can be comfortable with things that you need to do. Then take the actual courses, and these are the courses. Like nobody says these are organized like lists of, okay, take Dr. Aaron Nicholas' course of 1 hour molar, no, 1 hour endo. What is it called?
1 hour molar root canal build-up and crown.
Okay, perfect. So 1 hour. So nobody says, but people do talk about the cois and spear, which are great, but I don't think they're covering the basics. And so in my mind, like there's a huge gap of like, hey, you open a startup, here's the things you need to do before you even get to cois. Take these 5 courses so that you can get the revenue going. And I started to make it blunt like a business, but it is a business. You're running a business. So you start seeing patients, you're doing these procedures, you start getting the revenue, and then you can go and do the stuff like cois and spear and whatever you want to do to get certified with them. It's like a building blocks. And to me, it's like non-existent because I do talk to startup people. And when I told them about your course, they're like, but I don't have money for CBCT. I'm like, you don't need CBCT. The way Dr. Nicholas teaches it, you don't need anything. Like, let's go. Monday morning. And she was surprised. So primarily, I'm doing this podcast for her because once we're done recording, I'm sending it to her.
Okay. All right. So let's go back 3 steps. So first off, You have dental schools that are accredited by whoever they're accredited by to try to make sure that we don't have Joe's fly-by-night dental school in the back of the barbershop. Okay. Then
Makes
as
sense.
the students are going through, they're taking national boards, which is also supposed to make sure they have the requisite knowledge, both in scientific, which is the first set of boards, and then in the skills to do dentistry, that's the second set of boards. Okay. Now what you're saying is you want them to jump through yet another hoop so they can open a practice. And maybe they're going to take their practice and it's going to be limited to ortho and sleep. They've already decided they know somebody who does it. That's what they want. It's what they've always wanted. Are you going to make them go out and prove that they can do enough class 2 composites to make you happy, or that they can extract X number of teeth? Or, at some point, you have to kind of let them fly and figure out their own thing. And I don't think making another set of rules is the right answer. Do I have a better answer? No, not yet. Okay. But right now, I don't think making another set of rules, another set of hoops for them to jump through is the right answer. I went out, started up a practice. I was actually negotiating and getting it started up in the tail end of my third and all through my fourth year of dental school, and then opened it up almost as soon as I came out. Okay. I worked as an associate other places. It's kind of a hard way to go. I didn't do an AGD. I didn't do a ton of C at the beginning. And I kind of learned as I went, and I was working at my practice and this other practice. And as my practice got busier, then I pulled over. I did have the advantage to be able to talk to the owner doc from the other practice. So that was helpful. But then I just had to start looking at my deficiencies and start taking courses for those things. The one big advantage clinicians now have is you guys have online stuff. So remember, I graduated dental school in 1987. And I opened a practice in 88. Yes, before you're born. It's okay.
No, it was actually a few years after.
Okay, well, there you go. And then opened a practice in 88. And there's no internet. There's no podcast. There's no YouTube University. Everything comes through in a magazine, and it's a year to 2 years to 3 years late. And so there was no place to go and see those things. One of the big advantages that clinicians now have is you can go on YouTube and see any procedure you want. And it lets them see what the gap is between where they could be and where they are now, and let them start that process of, let me figure out where I'm going. And the other thing too is docs now have to be much more cognizant of the business end of dentistry, because the debt they come out of school with is so much greater than the debt that I came out of school with. So you've got to immediately start thinking about that. When I came out of dental school, we knew some of us would be in partnerships. There were not very many groups at all, but most of us were figuring on being in private practice by ourselves. I think those numbers have changed a lot at this point. Now you have big groups, you have some partnerships, and probably the solo practitioner still is a fair chunk of the of dentists. But there are a lot of practitioners coming out there like, I never want to own a practice. I don't want to run the business, and that's fine. And then there are other doctors coming out going, I actually kind of like that business part of it. I want to learn how to do dentistry and be good at my craft, but I kind of like the business thing. And I think I'd like having other docs around me when I'm working and that sort of thing. And that's legit too. There's so much more flexibility now than there was when I got out of dental school. So we would have guys, we would say to the guys that came out before us, like, oh, you guys, the bread and butter dentist, like Drill, Phil, and Bill was the name of the game. Kind of gets boring after a while, and we'd say, oh, you're the golden age of dentistry. So now I've had docs come and say to me, oh, you are the golden age of dentistry. And I tell them, like, absolutely not. You guys have so much more opportunity and so much more flexibility than what we had thought of. Not that we couldn't have done it, than what we had thought of. I'd be, other than that big school debt, I'd be pretty excited about coming out of school right now. There's just so much more to do, so many more options.
And talking about the school debt just for a second, I think one of the biggest things that can help you pay off the student loan is having your own practice. I know it sounds backwards that in order to open a practice, you're going to take more debt, but I believe you're in more control by having your own practice and paying it off quickly versus working for somebody and you have a fixed income that you can't make more than somebody will say you'll be making. And so, all right. So if we go back to the 2 procedures, what is the outline of what you teach? I don't want to sell the whole course, but I do think it's important for people to know Like, what should they expect if they take your course, or I mean, for any other course for that matters. But I would like for you to start with yours, so that people are familiar and they know, okay, this is what I'm going to learn. These are the tools and bells and whistles I'm going to use, and what are the expectations at the end of it.
Okay. So I sort of see the course in three pieces. The first part is me showing you what's possible. Okay. So, we're going to cross 1,000 docs being trained by me this year, I believe. And we've had a lot of docs come through and have some pretty spectacular results. We've had docs that have only done like anteriors that go out day one and they do a molar root canal. They find all four canals with the crown and they're done in an hour, hour and a half, which is, spectacular versus what they were expecting. There's a whole shift in mindset. There's the old, Parkinson's law. Work expands to fill the time allotted. So if you think it's going to take you 3 hours to do a molar root canal, it's probably going to take you 3 hours. On the other hand, if you don't know about some efficiencies, it might not be your fault. So, I mean, I've been practicing for a very long time, and I'm just sort of efficiency motivated. And so I have a very standardized way to prep a crown, do a root canal, et cetera, et cetera. I mean, the very first thing is like you prep the crown first. Completely counterintuitive, but makes everything else easier. So once you start there, and that just makes the whole process go a lot quicker. And we literally have it down to step by step by step. You do this first, then you do this, then you do this. Do not go to the next step until the step you're on is completed. And it's just that simple, because a lot of times what people say is everything was going great. And I got down to the last 2 millimeters and then it was calcified down there. Well, first off, teeth don't calcify from the roots up, from the apices up. They calcify from the pulp chamber down, which means that the reason that you got into a problem down there was because you had another problem upstream that you didn't fix first. And it just came home to roost once you got to the end. Okay. And so that's why you get stuck in that situation. And that's why we say, these are the steps. Be sure you get these done first before you go to the next step. That way, when you get to the apices, it's still clear and it's open and life is good and you can make that work and you got a shot at that. So that's kind of part one. Part two is there's a lot of rules of thumb and things that people say that we take as gospel that just aren't. When you start looking at the research and you start looking at actual results rather than what somebody's telling you off the top of their head, no matter how many root canals they've done or how many extractions they've done, a lot of times we have impressions about things that just aren't true. And so you start looking at the research, well done research, because there's a lot of it out there. They have a conclusion and they do the research and you end up at the conclusion they had to start with. So not too helpful. But anyway, when you start looking at the research, you find out that some of the things we've been told are not true, such as you mentioned the friend with the CBCT. You do not need to take a CBCT on every molar that you do to do good molar root canal therapy. I did for years, decades, and it was fine. Okay. At the same time, having the advantage of a CBCT, where it's sort of like where the canals are before you start, makes your life a little easier. But there are also a lot of rules and a lot of averages that we can look at and things in the anatomy of the tooth that will tell us where the canals are. So, you don't necessarily need a CBCT, although there will be people online who will swear to you that if you do not have a CBCT and a microscope, you should not be doing molar endo. Completely disagree. Okay. And then finally, there's what's the process? What are the steps? How do we go through there? How do we make sure that we've cleared one step before it's time to go to the other step? And then the more standardized we can make it, and the more we can make it the same over and over and over again, the more that when something pops up that's different, we go, oh, okay, this is a variation. And so we're at this stage. I know how to accomplish this thing to take care of that variation. And then we just keep going. So it makes a lot more sense rather than, you're working through things. You're like, oh, I didn't quite get this done. Let's go to the next file. It'll probably be okay with that one. And then you separate a file or it doesn't fix it. And then, you're working for hours trying to get through a blockage and that sort of thing. And for that matter, how do you get through a blockage efficiently? How do you get past a ledge efficiently? Those kinds of things where there are very predictable steps that you can go through to work yourself through that and be done in a few minutes rather than working and guessing and going back and forth between rinsing and files and it taking you a half an hour to an hour. How's that?
It's perfect. I mean, I'm listening to you. I'm thinking I should have been an endodontist. So I love this kind of stuff. I mean, I'll be cleaning root canals every day. Um, so if somebody goes to your course, and let's just say right now they either don't do root canals or it takes them 3 hours, like, can they expect right after the course to cut down the time by like half, like, and do it in an hour and a half?
I'd say that they would be able to cut their time down a lot if they've done no root canals up until now. You're kind of almost relearning from the start because you're having to get the feel of the instruments and what do they feel like and how do I know if I'm overstressing them, et cetera, et cetera. And it doesn't take too long, but it's going to take a little bit of time. If you're already doing anteriors, what we have found, so we run a return on your investment challenge, and the idea is that when you've done enough root canals that you've paid for the investment of this course, you send me a picture of the completed root canal because it's 2025, and if we don't have a picture, it didn't happen, right? So you send me that picture, you tell me ROI, and then you give me a physical address, and I will send you your ROI gift. Okay, it's just a way to sort of motivate people and encourage them to implement what they're learning. So if you're already doing anteriors and/or bicuspids, we know that it's going to take you about 7 to 10 business days to hit your ROI, provided that you have cases coming in. Because sometimes, like, you're flooded with cases, you take the course and it's like 3 weeks and not a single molar root canal comes in the door. And that happens occasionally, but overall it works out fine.
What's the ROI gift?
The ROI gift is usually a book that I have read and find to be particularly helpful.
Oh,
I think Atomic Habits was the last one that I gave.
I thought it would be a bottle of whiskey.
Not everybody likes whiskey, Tiger.
Okay, wine, whatever, but like, let's celebrate it. Look, a book, Atomic Habits. Oh my God. All right. Does the brand of the file matter?
Yes and no. Okay, there are some. So you have kind of the name brand brands, and then you have kind of knockoff brands. I'm not a fan of some of the knockoff brands because I've used them and they
Can you name them?
I'm not. That just sounds like you're going to get me in trouble. No, everybody knows who the cheapest file maker out there is. Okay, so when you're paying a little more.
Can I have you write an article at some point, like just ranking all the files?
I don't use all the files. I mean, I personally use the ProTaper system, and we teach the ProTaper in the Wave 1 system simply because Wave 1 is what they're using in most of the schools, and ProTaper is what I've been using for forever. Okay, so we teach those two. I've had people come through with Brasseler, and that's fine. I've had them come through with Cybernendo, that's fine. It's not really about the files, and that's another one of those misnomers. It's like, it's not about the files. As long as it's a well-made file, preferably heat treated these days, not necessarily, but preferably heat treated for me, you're going to do fine. It's just a matter of seeing, what the system is that the manufacturer has created and how he wants his files used. And that's fine. It's not about the file. It's about going through the process in a standardized manner and knowing where you are in the system as you're finishing up as you're going through the root canal process. That's what's going to get you efficiency and better results, because if you can standardize everything, then you're going to get much better results.
Are there any files you wouldn't recommend?
That's the same question in reverse. Yes, there's some files I wouldn't recommend. And guess what? I have a lot of students that use those files and love them. So, sometimes it's just me. For me,
okay,
if the file unwinds while I'm using it, I'm not happy. If it breaks, I'm really unhappy, but I haven't broken a file in quite a while.
Well, that's my question. What happens if you break the file? Like, do you remember the last time it happened?
Yeah. So sometimes you can work around the file. Okay. Sometimes it's in there, and now your choice is, I want to be someone who can retrieve these files and spend the time and do that, in which case it's okay. You're going to need probably an ultrasonic unit, and you might need a microscope. Okay. So just like with retreats, you might need a microscope if you're going to do retreats. I'm really training more for initial root canals. The other thing too is, if you have a root canal, it's going to take a really long time. I have an endodontist. I send her cases on a regular basis. They're the ones that are going to take a long time, or the ones where it's like a retreat that I'm not sure why it needs to be retreated. It's like, they go to her. Okay. If I separate a file and I can't get it out, it goes to her. Okay. Those things don't happen very often, but you always need someone in your back pocket. It's like if you're an oral surgeon, you got stuff going on. Sometimes you need ENT in your back pocket in case you have a problem.
I'm really curious. Like, imagine you sent like 5 patients in 1 month to endodontist to retrieve the file, the
Yeah, no,
broken file. And
no.
is she like happy because you're sending business, or she's like that guy?
No, what she tells me when I see her at Christmas parties, what she tells me is, I appreciate you sending me cases. We always add a half an hour to the appointment when you send them because we know if it was easy to do, you would have done it already. And I'd always say, I'm sorry and you're welcome. I mean, I don't, I, younger doctors who are just learning how to do root canal therapy have no business doing really difficult, crazy anatomy. Okay. If you've got really crazy anatomy, it's going to take you forever. It's not going to be profitable. It's going to kill your confidence. Send it out.
Would they know though? Like somebody who's never done a root canal, and it's okay before your course or after your course, would they be able to tell the difference? Is it a crazy one or not?
Most of the time they can, because you're looking at roots that have like an S curve in them or have a really steep curve in the dilaceration in the root. Most of the time you have a pretty good idea that it's going to be really tough.
Okay, and the X-ray can tell you that. I mean, you
Usually,
could do it by looking at the X-ray.
yeah, you could see on an X-ray, you could see it on a CBCT. A patient that won't open, a patient that won't follow instructions. All these things make doing the work
But we're not
harder.
using CBCT.
We're not, but you could, if you had a CBCT and if you were shooting CBCTs on all your endo teeth before you did them, you would see a lot of those things.
Okay, so but you also go over that in the course, like on how to train your eye to see if it's a complicated case.
Yeah, most of them know that already because they've gotten involved and had a problem already. But yeah, we talk about that too.
Or you just lessen their threshold. Maybe it's the opposite. Like, okay, no, you could actually be comfortable with this case. Like, that's not too complicated.
Yeah, and the other thing too is like start with the easy cases. Eventually, you will get yourself into a case that is more difficult than you thought it would be. Follow the principles, you're going to be fine. Now that one becomes more within your wheelhouse, and then you'll get yourself stuck on another one that's more difficult than what your new abilities are, and that's how you get better and better with more and more experience. But don't start there. Start with easy ones, build your confidence, and keep moving.
Okay. What is your what is it? Parting wisdom.
My parting wisdom. Um, there was a business course I took a long time ago. And one of his sayings that he always said, he said it over and over and over. He said, always protect your confidence. He said, if there's someone's offering you some work and it's way below what you can do, and it's so simple, like you can barely even like, yeah, we'll just give that to one of our underlings and get them to take care of it. You're not going to do a good job because it's not challenging for you in any way, shape, or form. Not the person you're dealing with, not the location, not the work itself. Like there's nothing that's really special about that. Then there's the stuff that's kind of in your wheelhouse, that it's interesting, it challenges you enough, et cetera, et cetera. Then it's way beyond anything you've ever done before. He's like, you're going to get there. Start here. Protect your confidence, because having the confidence to know you can handle something is what will allow you to take the next step forward to the next hardest thing. Whereas if you get in over your head and it just floors you, now you're going to be really reticent to step forward and do the next hardest thing. And you're actually impeding your progress by trying to go too fast. So I would say, whether we're talking about extractions, whether we're talking about root canals, it's like, look at kind of what you can do and just take baby steps going forward, but don't abandon it all. Don't rush too far forward too fast, because you want to protect your confidence as you're learning and upgrading your skills.
Awesome. Aaron, thank you so much. I'll link everything in the podcast so people can find you and register for the course. When is the next one?
Next one is December 6th, and it's going to be in Florida.
Okay, fantastic. Hopefully listeners will take you up on that. If not,
Okay.
I don't know what else they need, but
Yeah,
clearly it's a much needed course.
Yeah, the other thing, the day after that, we're doing the extraction course, surgical extraction and socket grafting. Because of the changes in the Florida laws, you have to be a Florida doc or a doc with 10 years of experience if you want to take that. If you want to, it's a live patient. If you want to take them back to back, there's a bundle price, and there's also a discount for this course this time around, because we're not going to be able to operate in Florida anymore. And so we're going to be moving on to a different state, which I already have mostly figured out. And once I'm 100% sure, we'll start talking about that.
Okay, awesome. Again, Aaron, thank you so much.
Thanks, Tiger. Take care.
Bye-bye.